Good morning, everyone. My name is Lisette Thiel, and I'm the Consumer Health Librarian here at East Brunswick Public Library. Today's presentation, Healthy Hands, Understanding, Preventing, and Managing Common Hand Conditions. This presentation is by Dr. Alisha Sharma. Dr. Alisha Sharma is an occupational therapist, and this presentation is brought to you by the Just for the Health of It initiative to promote health, wellness, and health literacy in our community. Please hold your questions until the end or post them in the chat for the Q&A session. And without further ado, Dr. Sharma, Alisha Sharma.
Thank you, Lisette, for introducing me. So hi, everybody. I'm going to give a little bit of a background information about who I am, my professional career so far, and then we're going to dive right into some common hand diagnoses. So again, my name is Alisha Sharma. I've been practicing as an occupational therapist for almost 5 years now. I do have a concentration in hand therapy, so that's my interest. Occupational therapy is a very broad field, and you can work in a lot of different practice settings with pediatrics, adults, older adults. We work in hospitals, we work in schools, we work in outpatient settings. And the setting that I'm currently in right now is an outpatient setting. I'm at ProFysio Physical Therapy. We have a few offices located within Central Jersey. The one that I am based out of is here in East Brunswick. So if you're interested in seeking some care for your hands, your upper extremities, or physical therapy for the body in general, you can always come here. So talking about a little bit of hand therapy, why I love hand therapy. We don't realize how much we depend on our hands every day to do daily activities, whether it's brushing our teeth, drinking a glass of water, signing our name. We use our hands for practically every single thing in every single aspect of our life. And so hands are very important in that aspect. The loss of one hand or having an injury to one hand can contribute to a significant percentage of disability, of overall disability in your daily functioning. And so for me, being able to manage hand conditions really allows people to return to their meaningful activities again. And so just jumping right into hand diagnoses, the first one that we're going to be talking about is carpal tunnel syndrome. So carpal tunnel syndrome is one of the most common hand diagnoses. Just as an overview, we talked about this already. Hand conditions affect daily activities and your independence. Going into carpal tunnel syndrome, as our first diagnosis, we're going to be talking about the etiology. So understanding how it arises can help you detect whether or not you have it, and then you can jump right into prevention strategies to prevent it from getting worse. So carpal tunnel syndrome is compression of the median nerve within the carpal tunnel. So risk factors include repetitive wrist and hand motions, obesity, pregnancy, diabetes, gender, and age. So talking a little bit about the risk factors, if you can imagine that the carpal tunnel is located right at the level of the wrist. If there's any sort of edema or what we call swelling at that level of the wrist, you are likely to have compression of the median nerve within the carpal tunnel. And so with a diagnosis such as pregnancy, because there is an increased fluid load in the body, that is why the median nerve would be compressed. And so a lot of cases that I see is also women just during their pregnancy, and then afterwards it does go away. But for a lot of people, it may not go away, right? And so for those population of people, maybe they are performing repetitive wrist and hand motions. And it might not necessarily be repetitive in the normal way that we think about when we're playing sports. It might just be repetitive with computer use and keyboard use. A lot of patients that come in with carpal tunnel actually are patients that have desk jobs, whether they work from home or work in person in the work environment. They're constantly on the computer. They're typing with their fingers, they're using the mouse, and they're constantly just bending their wrist in small, minute motions that cause that swelling. The neutral position of the wrist, I don't know if you guys are able to see me, but this is the neutral position of the wrist. And so when you're using a keyboard, especially if you're not in an ergonomic setup, you might be causing strain at the carpal tunnel, and your wrist might be sitting in a more extended position, like so. And so because of that, and because you're maintaining that position for long hours, 8 hours in a day, you might be causing irritation at that level of the wrist. And so that can contribute to compression of the median nerve as well. And so symptoms of carpal tunnel that you might feel are pain, numbness, tingling, and hand weakness. So typically when we have numbness and tingling with carpal tunnel, we feel it in the first 4 digits. So that includes your thumb, that includes your index finger, your middle finger, and then half of your ring finger. This is a typical distribution of the median nerve at the level of the hand. And so these paresthesias, or numbness and tingling that we feel, can increase when we're performing computer-based tasks. However, I've also seen people experience these when they're performing repetitive gripping motion. And when do we perform a repetitive grip? When we're driving, when we're holding onto a steering wheel, we're constantly gripping onto the steering wheel. And what that's doing, just to dive a little deeper into hand therapy, that's bringing your flexor tendons into the carpal tunnel, retracting them back into the carpal tunnel, and that's increasing, again, the pressure and load that's within the carpal tunnel, causing the median nerve compression. Now, I'm not saying that everybody experiences this. However, there is a large majority of the population that does experience this. And when we talk about risk factors, including gender and age, people typically between 30 to 60 years of age will experience carpal tunnel, and women are 3 times more likely to experience carpal tunnel as well. So one of the tests that we do as hand therapists is a Fallon's test to assess for carpal tunnel. And so if you can see the image on the bottom right, the way to perform this test is basically to have you compress your median nerve, to have your arms in this position and hold it like this for 30 seconds, either 30 seconds or 60 seconds. It's up to you. And if at the end of those 30 or 60 seconds, you're feeling numbness and tingling within your thumb, index, middle, and ring, and it might not be all of them, but it might just be, for example, your thumb and index. If you are experiencing those, then you know that, and if it's in your left hand or right hand, most likely it would be in your dominant hand, then it might be that you do have carpal tunnel or the beginning symptoms of carpal tunnel. So what are some ways that we can prevent carpal tunnel? Again, we talked a lot about how the desk setup matters. So having an ergonomic workstation with a neutral wrist position. So a lot of times keyboards, the ergonomic ones, the really nice ones, they have a little bit of a cushioning right at the level of the wrist. And so that prevents that excessive extension that your wrist has to perform and keeps your wrist more in a neutral posture. We always recommend taking frequent breaks so you're not working for a prolonged amount of times and causing that strain for a prolonged period of time. And then stretching and strengthening the forearm and wrist muscles. And stretching, for example, is just holding your hand, pushing back just lightly, no overpressure, and holding your hand, pushing downwards in this position. And again, no overpressure. Nothing when you stretch should cause pain. It should feel good. Stretches are typically meant to feel good. Okay, and then strengthening. We do prescribe a lot of exercises here in hand therapy. A lot of them are with just light weights, maybe 2 or 3 pounds, to work on wrist flexion, wrist extension, just to strengthen your overall muscles of your forearm and wrist. Now, what do you do if you do have carpal tunnel? So one of the ways that we mitigate that is by splinting or providing a brace. And this brace keeps your carpal tunnel or your wrist in a neutral position. And I say especially at night because a lot of times when we're sleeping, we don't know where our hands are doing. We're just concerned about sleeping. But we might be sleeping in a posture that's not optimal. And we might be kind of rolling our wrists in a awkward position, and we feel it when we wake up, but not in the moment. But it's when we wake up when we feel it. So we want to keep that brace on to keep it in a neutral position. We prescribe nerve glides and tendon glides. So median nerve glides will help a lot. I have an example of tendon glides below. So these are flexor tendon glides, and these help as we were talking about the flexor tendons retracting within the carpal tunnel. So these help move the flexor tendons in and out of the carpal tunnel. So things are staying mobile. Things are not just staying stuck in the carpal tunnel and really stiff. Things are just moving and being fluid. And so these particular tendon glide exercises, if you are experiencing paresthesias, these help relieve those paresthesias almost immediately. A lot of patients will perform these exercises even in the middle of the night if their carpal tunnel is bothering them and they're experiencing pain and numbness. If you perform some of these tendon glides, it automatically starts moving those tendons within the carpal tunnel, and the pain is mitigated that way. Heat and ice as appropriate. For the most part, I feel that patients benefit from heat. Most of my patients benefit from heat, but some do benefit from ice when they are in their severe stages of carpal tunnel and they haven't had surgical management yet. They just have a lot of edema, a lot of swelling, and so that ice feels really good on the skin. And then surgical release for severe cases. So carpal tunnel does allow or carpal tunnel does have the option to have surgical release, and there are two different types of surgical release that can be done. Typically, it's a 15-minute procedure. The two different types of procedures are, one is an endoscopic, it's kind of like robot assisted, if you may, and the other one is traditional, the traditional method, and both of them are very quick procedures, 15 minutes, and you just require local anesthesia. Benefit of one over the other, people are tending more, or surgeons are tending more to do like the robot assisted method, the endoscopic method, but there might be more benefit to doing the traditional method, and that's just because you're able to visualize better. With a robot, you might have to go in again, maybe it doesn't open it up fully. Okay, the next diagnoses. Osteoarthritis. So this is a big one. There's a large amount of the population that will be guaranteed to get osteoarthritis after the age of 50. And it's degenerative wear and tear of the cartilage in our finger and thumb joints. So this could actually be throughout the body. It could be your shoulders, it could be your wrists, it could be your knees, it could be your hips. But in terms of hand therapy, we deal with a lot of osteoarthritis cases in your finger and thumb joints. It often affects the first CMC joint, which is at the base of the thumb. So a lot of patients will have pain right around this point at the base of the thumb. Risk factors for osteoarthritis include age, genetics, repetitive stress, and also prior injury. So if you've ever had a fracture to your hand in the past, more than likely you will develop osteoarthritis to that joint later in the future. Now, that's not guaranteed, but it is, I guess you can say, there is a higher chance of you developing osteoarthritis because of the prior injury and prior scarring within that area of the body. Symptoms of osteoarthritis will include pain, stiffness, swelling, and reduced motion. Give me one moment. I have some information just about kind of like the prevalence of this as well. So after the age of 55, 40 to 60% of adults will have osteoarthritis, and 1 to 2% per year in adults over 50. Okay. So in terms of prevention, what do we do to prevent it? Because we can't undo it, but we can prevent it from getting worse, right? There is surgical management. People typically don't get surgical management, so let's talk about the prevention aspect of it. So joint protection techniques. If you ever have large jars and containers at home that are difficult to open, we're oftentimes putting too much strain on the smaller joints of our fingers. So using tools like the one that you see in the bottom right to open a jar allows you to use your forearm muscles to open the lid rather than really having a tight grip and putting stress on the smaller joints of your fingers. Avoiding prolonged pinching and gripping. Things that would involve gripping and pinching for a prolonged amount of time might even be handwriting-based tasks, for example. If you're doing handwriting and applying a lot of pressure on top of like a pencil or a pen for a prolonged amount of time, that is putting a lot of stress on those joints. And so avoiding doing that for prolonged periods would be important. Using ergonomic adaptive equipment to reduce joint stress. So again, on the bottom right, but also on the bottom left. So if you see those utensils, they have a built-up grip. For a lot of patients that have osteoarthritis that is severe, that is in its later stages, having equipment that has a built-up grip will help you, one, be able to use the utensils that you need, but then it would also allow your joints to have less stress on them. All right, management for osteoarthritis. Typically, osteoarthritis benefits from heat. People will complain in the rain and cold weather that their joints are hurting. So heat therapy does definitely help. In our practice here, we have heating pads, moist hot packs. We have paraffin wax. And then in other practices, they might also have fluidotherapy, which is kind of like they say that it's synthetic corn husks. They're heated to about 115 degrees, and it just feels like putting your hand in a sand bath, like a really hot sand bath, and that feels really good on with patients that have osteoarthritis. Splints, like the one that you see below, this is for that osteoarthritis that you have at the base of the thumb. That will help significantly. It'll still allow you to perform your daily activities. It's mobile and flexible enough to allow you to perform those daily activities, but it is immobilizing the CMC joint at the base of the thumb. Therapeutic exercises for mobility and strength. So we do have a large amount of exercises that help osteoarthritis pain. Again, if you're putting a lot of stress on the small joints in the hand, but you're not exercising them regularly, then you might develop deformities in your hand where things are shifting out of place. And so maintaining normal strength is very important for osteoarthritis. When you come in for a hand therapy evaluation, one of the first things that we do is take grip strength measurements. We have a chart that kind of goes over grip strength for someone based on their age and gender. So, for example, female, 55 years of age, where do they fall in terms of what their normal grip strength for their dominant side looks like? And so we're able to compare, okay, what is your grip strength right now to where it's supposed to be for based on your age and gender. So we do have norms to kind of compare to. Okay. Adaptive devices for daily activities. Again, we talked about that on the last slide. All right. Next diagnoses, trigger finger. So trigger finger is caused by inflammation or thickening of the tendon sheath at the base of the involved finger. So just to go a little bit more in depth, the fingers have pulley systems, and this is at what we call the A1 pulley. So at the base of your finger, if you have trigger finger, you'll feel a nodule. And what's happening there is it's getting inflamed and thickening by repetitive gripping motions. And so if you do have trigger finger, that particular finger, when you are performing a gripping task, might lock or catch during that movement. It is more common in patients that have diabetes. 2 to 3% of the general population has trigger finger, and it's estimated at 28 cases per 100,000 people per year. And again, in patients with diabetes, it is up to 10%. So trigger finger prevention, avoiding forceful, repetitive gripping, modifying tools to reduce finger strain, and taking breaks from prolonged grasping tasks. So I do have a wide variety of patients that perform different job tasks. One of them, for example, who has trigger finger is also someone who just performs a desk job. And their keyboard setup and their mouse is very small. And so we're kind of, as therapists, doing detective skills to figure out what is causing the triggering. So in their day-to-day, they are performing a lot of handwriting-based tasks, taking notes, as well as using a keyboard and a mouse. And unfortunately, because that mouse is so small, that's putting too much strain on the ligaments and tendons of her hand. And so recently I had recommended an ergonomic mouse. So different from the normal mouse that we see day to day, an ergonomic mouse allows your hand to rest in its normal curvature and will prevent that patient from having to perform repetitive hold or squeeze on the smaller mouse. All right, so trigger finger management. Splinting the finger in an extended position. So again, if that pulley is what's getting that tendon, if that pulley is getting that thickening or that inflammation, splinting that finger to keep it straight and immobilized will help that inflammation go down. Gentle stretching and tendon gliding exercises, steroid injections if conservative treatment fails, and surgical release in severe cases. So oftentimes with even with therapy, trigger finger will still return. So at that point, we recommend steroid injections, and that does help a significant number of cases. Doctors will typically give up to maybe 2 to 3 injections. It used to be 3, but now I see more doctors doing just 2 injections max for a trigger finger. And so having a steroid injection at the base of the finger where that nodule is developing helps uh, that inflammation from getting worse and worse. And then surgical release in severe cases. So surgical release will kind of open it up where that tendon is thickening, and it will prevent it from catching within the fascia. All right, next one is tennis elbow or lateral epicondylalgia. It's hard to pronounce. We used to say lateral epicondylitis, but as research came out and more information came out about tennis elbow, it's not so much an itis, which is inflammation. It's more so small microscopic muscle tears that are at that lateral epicondyle, at that tendon leading to the lateral epicondyle, rather. And that's from all of your extensor muscles. So your extensor muscles are at the top of your forearm on this aspect, and so your flexor tendons are on the opposite aspect. Okay. It's common in racket sports, for example, tennis, but it might not be either. It might be another thing that's also related to typing tasks as well. I do have a significant number of patients that perform typing tasks that have tennis elbow. And we were talking about how carpal tunnel puts strain on the wrist by keeping your wrist up in this posture. It's also putting strain on your extensors. Your extensors are the tendons tendons and muscles that are on this side of the hand. And so if you can imagine, if your wrist is in an upward position, you are contracting those extensors repetitively and keeping them in this posture. And so you will have pain at the outer elbow or your forearm, and it does get worse with gripping, because if you do have those micro tears develop, now when you're gripping something, those tendons and those muscles are now being stretched. So from typing all day and being in this posture to now gripping something, you are stretching all these tendons and muscles. And so those small tears are being stretched. And so you might find that you don't have as much strength to be lifting objects as you used to be. And it's worse typically in this position when you're gripping something rather than this position, because you're putting more load on your extensors, or you're putting more stretch on your extensors in this position. So tennis elbow prevention, proper ergonomic technique in sports and work. So tennis elbow, they say, typically develops if you have bad form in tennis. So having the proper ergonomic technique, using lightweight tools with cushioned grips. So if you do have tennis elbow developing, avoid those gripping tasks. Use something with a cushion. Stretch and strengthen the forearm muscles regularly. So always maintaining good stretches before doing sports, and strengthening the forearm muscles, which if you come as a patient here, we can definitely talk about. All right, so tennis elbow management, wrist extensor stretches, eccentric strengthening exercises, counterforce braces for activity, and heat and ice as appropriate. Counterforce brace is what you see below. And I chose this particular image because if you could see the musculature of this person, you can see all those extensors being loaded and contracting. And if you could see the top of his forearm, you can actually see his extensor muscle belly, right? And so that is those are the muscles that are being contracted, and the counterforce brace applies pressure over them so they're not constantly tugging at the lateral epicondyle. So that's why it's called a counterforce brace. You're preventing its full contraction, and you're kind of stopping it with the counterforce brace. Typically, we use ice at the very beginning when someone is in acute pain, and in later, more chronic stages, we'll tend to use heat. Okay, so decurved veins tenosynovitis. All right, so decurved veins tenosynovitis is inflammation of tendons at the thumb side of the wrist. If you can see the photo below, it's at the APL and EPB tendon right at the side of the thumb. It's often caused by repetitive thumb movements, so texting, lifting babies. And I have lifting babies in there for a particular reason, because decurved veins tenosynovitis is typically associated with new mothers that are lifting their toddlers or their little ones. When your thumb is constantly put in this position, again, I hope you guys can see me, but when you're holding a small child, your thumb is like in this position and you're lifting them up. If you can see, you might be able to see on your own hand, these tendons pop up a little bit. It's difficult to notice on my hand, but in some patients, I can really see those tendons popping up. And if you're doing that constantly all day long, then you're increasing a load to tendons that maybe before you had the child didn't have that increased load on them. And so because of that, it is associated with being a condition that new mothers tend to get. The symptoms are pain at the wrist base, and they are worse when you perform thumb motion. So now that these tendons are inflamed at the base of the thumb, when you're doing other tasks, maybe that require other thumb motions, like bringing your thumb inwards, now you're stretching that area, and it's going to cause pain. So an ICOPS test is basically having your thumb inside your palm, making a fist, and then moving your hand ulnarly. So bringing your bringing your whole hand downwards. And so if you perform this, you might feel a little bit of discomfort right over here at the level of the wrist. In most patients, or even in the normal population, there is discomfort there. But for someone who does have decurved veins tenosynovitis, it might not be discomfort. It might more so be an ouch, like an actual pain feeling. And so that is one of the tests that we do for decurved veins tenosynovitis. We also do the Finkelstein's maneuver, which is very similar, but the therapist is taking your hand and passively moving it to assess if you have pain. Okay. Decurved veins tenosynovitis prevention. Before we jump into that, I'd just like to talk a little bit about the incidence and prevalence. So 3 to 4 times more common in women, decurved veins tenosynovitis, and about 0.3 to 0.8 cases per 1,000 people in a year. So it's not as common as the other ones that we discussed, but it is common enough. All right, so avoiding repetitive thumb-intensive activities, using an ergonomic grip for phones and tools, and alternating hand positions during tasks. So of these, I would say probably the one that I like the most is alternating hand positions, right? So instead of relying on your right hand, if you can rely on your left hand, especially when you have pain, that might help prevent it from getting worse. Ergonomic grips for phones and tools. Again, having a soft cushioned grip is really important, and repetitive thumb intensive activities. Avoiding the repetitive movement for all of these diagnoses that we talked about is very important. So decurved veins tenosynovitis management, thumb spica. So we talked about different splints for the different diagnoses. We talked about counterforce brace. We talked about the neutral position wrist splint that we discussed with carpal tunnel. This one is thumb spica. So if you could see, it has a component of the thumb, and it's keeping the thumb from moving. Okay. Stretching the thumb wrist tendons, gradual strengthening, and steroid injection or surgery for persistent cases. I don't see surgery too often, but I will see people getting a steroid injection. All right, so just to recap, For general prevention, warming up your hands before activities is very important, as we discussed, using proper body mechanics and posture, keeping an ergonomic work environment. That is probably one of the most important things that we discussed, taking breaks to avoid repetitive strain, maintaining overall fitness to support joint health. And then these are kind of just like fast key tips for each different diagnoses: nerve gliding and tendon gliding exercises for carpal tunnel syndrome, joint protection techniques and heat modalities for osteoarthritis, massaging the base of the finger at the nodule for trigger finger, maintaining your wrist in neutral, massaging and eccentric strengthening for tennis elbow, and immobilizing those inflamed tendons for decurvating sinusitis. The braces that we had talked about for the different diagnoses included the neutral wrist splints for carpal tunnel. The small one that it was a gray colored small splint that we showed for the osteoarthritis at the base of the thumb. That's called a short opponent splint. A lot of hand therapists will custom make it using splinting fabric or splinting material. So that's called a short opponent splint. Finger extension splints for trigger finger, counterforce braces for tennis elbow, and then the thumb spica splint for decurvating sinusitis. Okay, thank you guys for attending. If there's any questions, feel free to send them my way. And then this is just a QR code. We would love to have your feedback on this presentation so we can improve our programming.